to you. So let me tell you how Medicare works. It's kind of like they actually say it called the ABCs of Medicare, but it's really A, B, C, D, F, and so on. There's many, many letters of Medicare. So let me explain what this means. When you start working in this country and you pay on your pay stub where it says Medicare, and they take a little bit out of your check every week or month, that is basically your contribution to qualifying for Medicare, and you have to do it for at least 10 years. If you do that, then when you become 65, you become eligible for Medicare. Medicare is basically health care for seniors, and if you've paid into it for that 10 years and you've lived here and you're a citizen in the United States, then you now are qualified for Part A. Remember, these are the ABCs of Medicare. Part A is hospitalization only, and it has a deductible that you need to meet in order to, and like I said, you have to pay into it. If you don't, and you want Part A, you'll have to pay for it. It's not free. So Part A, if you've worked and are a citizen, you can qualify. It doesn't cost you anything, and that's hospitalization. Part B is all outpatient services. Outpatient services are things going to the doctor, you need an MRI, you need blood tests, you need anything else related to your health that you're not hospitalized and you're not taking drugs. Okay, so that would be all outpatient services is Part B. Okay, Part D, hence D for drugs, would be you're choosing a drug plan so that you can have your prescriptions covered. Okay, so that's A, B, and D. Now there's also Part C. Well, what's Part C? Well, Part C is what they call Medicare Advantage. And basically it takes Medicare Part A and B and it puts them together. So it takes hospitalization and outpatient services, which is Part B, and Part D, and puts them all together as one plan, and they call that Medicare Advantage, and that's a Part C. And I've had the opportunity to serve many of you in here, and some of you have this Medicare Advantage type plan. Medicare Advantage plans typically are your HMOs that you'll see on the marketplace today. Some of the familiar names you've heard of are probably the Blue Shield 65 Plus, Kaiser HMO, the Blue Cross HMO, SCAN, Secure Horizons, AARP. These are all your HMO products, and they're called Medicare replacements or Advantage plans. There's also Medicare Supplement plans. Those are different because what they do is they allow you to keep your Medicare, and then you purchase a supplemental plan, and they work together. So what I tell people, if you think of it like a puzzle, Medicare doesn't cover everything. That's why most people don't stay just on Medicare. You've got deductibles, and then when you purchase your Part B through Medicare, it costs around $100 a month. Those are the two basic things that you must have before you can purchase a Medicare supplement or an Advantage plan. And if you're going to, once you purchase those or you have Part A and Part B in place, then you can go out into the marketplace and talk to someone like me, and I can show you what's available in the marketplace, these Medicare supplements or Medicare Advantage. So what is the difference between a Medicare supplement and a Medicare Advantage? Because there's always a lot of confusion for people. They're like, well, what's the difference? Medicare supplements are basically you keep your Medicare intact. You have your Part A and your Part B. Part A, again, is hospitalization. Part B is all outpatient services. Then you purchase a supplement, and on the average, when you age into 65, it's around $160 a month. And then you must purchase a Part D, which is the drug plan. And all those things, then you have your Medicare supplement, your Part D, and they come together, and it's like a puzzle. And then it will cover your healthcare services. Okay. Now, the most common plan in California for a Medicare supplement is the F plan. The F plan is what many of you that are on supplements have in this room because it's what I consider the best plan option out there for value because it covers everything. You'll never see a bill. They coordinate your benefits and take care of everything. And the cost on that with your, when you're paying your premium through Medicare, and you buy a supplement with a Part D, on the average is about $300 a month. And that's really, really good coverage. And all you'll ever pay then is your prescription drug copays. So great coverage for about $300 a month when you're 65. Of course, the rates will go up as you age in and get older. But that's really good coverage. And if you're used to paying $700 or $800 a month, you're like, wow, that's pretty good. Now, there's always the tension about should I pay that much if I'm a healthy person or do I really need prepay for coverage every month if I'm not using it. So then you go into the Medicare Advantage arena. And these are different products. These are called replacements. They're not supplements. And those replacements, essentially, then what it says is the government is willing to pay, let's use Blue Cross as an example, X amount of dollars a month to take care of you. And they're going to pay them. And these are typically all your HMO plans. Okay? And then they're responsible for paying all the bills, and all the billing goes through them. None of the billing goes through Medicare. The tension there is it costs less, but HMOs, what are you giving up? You're giving up the freedom to self-refer, right? Because on the supplements, you have control. You can self-refer, do whatever you want. When you have an HMO, you are a captive client to that plan, to that group that you choose, and the doctors that are part of that group in that hospital. That's how HMOs or managed care work. So you just can't go and do whatever you want to do. And it works for many people, and for others it doesn't work at all. So it's purely a matter of what is best for you. So when you go into the Medicare arena, there's many, many variables, many plan choices, many drug plans available. It's about taking a puzzle, all of that information, looking at doctors, what hospital is important to you, what are the key doctors that you must have, what are the drugs that you're taking, what are the costs involved in those drugs. It takes me a fair amount of time to do an assessment on each individual. And I take my knowledge and I put it through, my system of how I work the system to make sure I'm giving you the best possible products that suit you. Because every one of you is different. One of you will say, well, this HMO will work fine for me. And someone will say, I don't want an HMO at all. I want a PPO. I want freedom to self-refer and to choose. I can afford to pay a little bit more. I can't afford to pay 2 nickels. Everybody is extremely different scenario, passionate about what they want. Everybody has an opinion. Husband and wives often don't even disagree or agree because they have their own opinion about what they want for them. No, it's true. So that's my 2-minute warning, obviously. As you can see, there's a lot of information related to Medicare, and I want to be able to give you, again, the best service that I can. It usually takes about an hour and a half of time, sometimes up to 2 hours to get through everything, fill out an application, make sure you've had all your questions answered. It helps me, again, a great lead for me is somebody that is aging into Medicare. Another time I'm very busy is during open enrollment. Open enrollment occurs every October 15th through December 7th. What that means is you're able to make a change if you're already in Medicare and you're not sure about what you have and you're thinking maybe I need to look into something else, or maybe it's gotten too expensive, I'm on a supplement, I can't afford to pay that premium anymore, and I need to see if there's something else available. You're welcome to ask me any question at any time, okay, and I will give you the most up-to-date information that I have. Is Medicare going to be changing? Probably. Is the whole industry changing? Yes, it is. I don't believe that they'll take these plans off the market any too soon, but there's going to be sweeping changes over the next probably 5 years. So I'm here to stay on top of those changes and answer your questions. So it is what it is. We have to deal with one day at a time, and we can't worry about tomorrow. We just have to live in the day. Because I'll say people be anxious, especially seniors. They get anxious about their future, and I understand that. But don't worry about tomorrow. We don't know what tomorrow will bring because the contract, it goes through the end of the year. They're not going to change anything this year. And then they'll let you know ahead of time, and then we'll address it at that time. Right? It's wasted energy to worry about these things. So I'm committed to, like I said, keeping on top of what's going on in the marketplace. We'll live in the moment. You should be grateful for what you have. It's still one of the best systems out there. When you look across the board globally, we do have a great system here. It's not perfect, but I'll tell you, where do you get free Medicare when you're 65 by just paying in 10 years? I mean, that's incredible. So you have the freedom to choose your doctors. So please refer me your people. Again, I will educate them. That's really important to me. Education is extremely important because with knowledge comes power to make the best decision for you. And I'm done. So I passed out, I'm sorry, one more moment. I passed out this paper that says the questions to ask when you're purchasing Medicare. These are just helpful tool for you to use, or if you know somebody that's aging into Medicare, give this to them and then have them call me. and I'll make an appointment. Yes, question?
And would you suggest somebody takes a look at?
You should be getting your Medicare card about 90 days before you turn 65. And I can't actually help them until they actually get that Medicare card and they are signed, they qualify for Part A and they're signed up for Part B. Once they have that in place, then I'm able to come in and help them choose a plan that suits them. Okay? Guaranteed issue is only 3 months before the month of your birthday and 3 months after. So if they have any health issues at all, they need to do it in that time period or they lose that opportunity. Yes, question?
As you know, signing me up for Blue Cross behind my Medicare program. I'm finding now that some doctors are not taking Medicare anymore. Does that negate the Blue Cross coverage?
If they, for supplements, if they do not take Medicare, then that plan will not work. Exactly. However, there's another option available to you. When open enrollment comes up next time, we can talk about that and see if it's a better fit for you. Okay? Okay, that's it. I do have one, can I ask a...
You're like 2 minutes over.
Am I really? I have a gift to give out. Can I do it? Ask. No? I don't have to. Okay, what are, just real quick, I have a question and I'm giving away movie tickets. So I'm going to give, one question is, what are the 4 parts of Medicare, if you can name them?
A, B, C, D.
Wait, hey, you can't just shout it out, you got to raise your hand. And Jean actually raised her hand first. Do you want to answer the question? Well, you have to tell me what they are, the 4 parts, and what they are. Wait, shh, be quiet, please.
A is for hospitalization only, B is outpatient services, D is drugs and prescriptions, C is the Medicare Advantage that puts the A, B, C together.
Yes, excellent. Okay, I have one more question, quick question, and that is, okay, one last question is, there are 2 different arenas in Medicare. What are they? Anybody? Raise your hand. Do not shout it out. Do not shout it out. Raise your hand if you know it. What are the 2 arenas in Medicare? I don't know if you guys caught this or not.
2 arenas?
Yeah, there's 2 different types of products.
HMO.
You have to know to raise your hand if anybody knows. Well, there's Medicare Supplements and Medicare Advantage. Those are the 2 different types. Okay, I'm over. Okay, I'll sit down.
Nice.
Thank you.
Good job.
All right.